Hello, everyone. Thanks for joining us. You are watching Ask the Mayo Mama Mayo Clinic's Facebook Live. Every 2 weeks, I host this show where we discuss common health topics in children. The goal of our show is to provide information, promote awareness, and engage with you, the viewer, in real time about pediatric health. Today, we're focusing on prevention, specifically the prevention of injuries in children. As a mom of 2 active boys, I know that accidents and injuries are going to happen in the day-to-day lives of my active children. However, there are some things that we can do to proactively prevent or reduce the risk of serious injury. To help discuss how we can promote safe activities for children and get his perspective on what he won't let his grandchildren do is Dr. Manaan Bach. Dr. Mannenbach is a board-certified pediatric and pediatric emergency medicine provider. He has provided care for acutely ill and injured children for his entire career in the emergency department setting. He has held a variety of leadership positions at Mayo Clinic Rochester and has led educational efforts focused on ensuring quality care for children in the pre-hospital and emergency department settings. He has special interest in the use of in situ simulation as an educational tool. He and his wife Liz have 4 children, 2 sons-in-laws, and 4 grandchildren, with a new grandson being born this week. Dr. Mannenbach, thank you so much for joining me.
Thanks for having me, Angie.
So, as a grandfather and a father and an experienced pediatric emergency medicine physician, you've taken care of a lot of children with injuries over the years.
Yeah, we've taken care of literally thousands of children in our emergency department during my career.
Wow. And we need to somehow balance, and the message I want to get across on our show is we need to balance kids being active with also safety. How do you talk about this with your patients?
Well, I think we want kids to have fun. We want them out there. We want them doing things. We know there's an obesity problem for children in this country. We don't want to encourage them to just bottle up inside and do nothing. At the same time, we know that there are things that they can do with their chosen activities to be safer during that time and reduce their risk of injury. But again, we want them to have fun. We want them to be out there doing things.
Absolutely. You know, the obesity epidemic in our country and across the world, kids are sitting more, and adults are sitting more too. So we need to be out active with families. Is there any ways that you encourage families to be active together?
Well, I think they just need to find something in common. They need to find something that they can all enjoy. You know, one might like to run, the other one might not, but where do you find some common ground? And I think the sooner you do that with your kids, as you make outdoor life part of your family's habits, I think you can establish those over the long term. And then help them, each one of your children, find their own niche and what they can do to stay active.
Absolutely. Spoken from experience there with the 4 children and grandchildren. So what are some of the most dangerous activities that you see children participating in and coming into the emergency department with injuries?
I can speak to our personal experience or our practice experience in that some of the things that are more likely to lead to injuries resulting in emergency department visits are motocross injuries, ATV accidents, and trampolines. Those are probably the activities that often lead to potentially significant injuries that require pretty sophisticated medical care for kids.
Yeah, those are the kids that are coming in with pretty high-level traumas, right?
They can be.
Okay. Well, let's start by talking about trampolines. I grew up with trampolines, but my dad was always very leery with the injuries because he saw some of these firsthand. So what are some of the injury risks that you have with trampolines?
So most often if a child is injured on a trampoline, it's usually a forearm fracture. So they break their wrist, you know, they break their radius or ulna. They may have an elbow fracture as a result of that. Now most often those kids, it's simply a cast and go home. But sometimes we need to reduce those fractures, realign them, and or they need operative intervention to take care of especially the elbow fractures after a fall.
Okay. I've seen a lot of new things being promoted that are supposedly supposed to be safer for some of trampoline use. Are there any things that we can do to actually reduce some of the risk, especially these fractures?
I think it may not be the equipment itself, although in Minnesota, many trampoline owners leave their trampoline out all winter long. And that can cause some unintended wear and tear on the trampoline so that when you get back out there in the spring, you may not realize that the trampoline's got some gaps in it. It may have worn out, it may have become thin, making children more likely to be injured.
Absolutely. What about some of those nets that you see? Are those actually helpful at reducing injury?
Yeah, in theory, that sounds really good. They'll stay on the trampoline. But generally, what's been found is that children that are on trampolines where there are nets might be involved in more risk-taking behaviors. They might then try to clear that net. they may try to do more acrobatics than they would
Right.
without the net, if you will. It's maybe a little bit artificial sense of security by doing that.
Okay. Is there anything the parents can specifically do when their kids are on the trampoline?
Absolutely. So I think the child that typically gets injured is the smaller one.
Okay.
If there's more than one child on the trampoline at one time, it's usually a little one that bears the brunt. Not necessarily flying off of the trampoline, but even impact while they're still on it. So in general, I think one rule is that parents can enforce, or we grandparents can enforce, is to say one child at a time as much as possible. We want them out there. We want them enjoying their time on that trampoline, but one at a time is probably the best way.
Right. So you don't need to put them in a bubble, but you can do it with reason.
Exactly right.
Okay. Is there a certain age at which you would say a child is too young to be on a trampoline?
Well, I think they have to have some pretty basic gross motor skills before they're able to get up there. Certainly walking easily, running pretty well, climbing stairs easily. I think they have to have a pretty good sense of their body and getting around. So I would say mostly by school age is maybe the lower limit for that.
Okay. Have you ever seen any spinal injuries happening with trampolines, especially with some of these acrobatic?
Sure, we sure have. It's not frequent. I don't want to oversell it or make it sound too scary, but we certainly have seen children with significant, serious cervical spine injuries, some with fractures, which will heal, but some even with spinal cord injury. So it is possible, but certainly not a frequent thing.
Okay. So the one kid at a time rule, that's going to require parental supervision, right?
Definitely.
And a lot of times parents aren't necessarily watching as closely, especially with all the distractions we have nowadays with cell phones and things like that. Any tips on how to have parents be more aware?
Well, and again, you don't know what happens when your child goes to someone else's home where there's a trampoline.
Very true.
Right? So what's happening at the neighbor's house around the block where there's the trampoline? So I think parents communicating with each other, looking out for our kids, our own grandkids in the neighborhood, saying, well, what's going on? And delivering a consistent message. Yeah.
One thing I could see in my family with my boys is the older one kind of bearing the responsibility, and I could see him very much being like, one at a time, you know, kind of. So teaching your kids maybe what those rules are before they go to might be helpful.
Sure.
Some kids may not be as attuned to following the rules as others, as my youngest child would be. So,
Sure.
absolutely. Well, you said ATVs was another very common high trauma based activity that we see kids coming to the emergency department with.
Right.
So
in our area, we see quite a bit. They're used on the farm.
Right.
They're used for transportation. They are not generally a competitive type of thing, but they're quite common. And depending on the area that you live in, region of the country, you will find more or less injuries. In our region of the country, thankfully, the injury rate has actually dropped a bit.
Okay.
And I think that's largely due to some preventive measures that have been put into place.
Would those be laws that you're referring to, or what are some of the preventive measures that have helped reduce those injuries?
Sure. I think part of it also is, remember the old three-wheel ATV?
Yeah, absolutely.
Yeah, the three-wheelers. Yeah. Thankfully, those aren't out there anymore, at least not being sold now.
Right.
I'm sure there are still some remnants that are still in existence. But just design-wise, the use of four wheels is certainly safer than three. They're less likely to tip over. The other issue, I think, is that I have the sense that people are getting the message about safety equipment when you're on that ATV, that you're wearing helmets, that the children aren't necessarily on there 2, 3, 4 at a time as well. So I think those things have made some differences.
Okay. When is the safe age for a child to be able to ride on one of these as a passenger?
As a passenger, that's a good question.
Versus driving, or both?
Well, I think it depends mainly on the driver.
Okay.
So the driver has to be skilled. They have to be able to negotiate a vehicle that can certainly go 40, 50 miles an hour potentially. And it's often in terrain, up and down, different areas that it's not going to be just smooth sailing blacktop roads. It could be on gravel roads or into ditches and things like that. So the driver really needs to be ready to control that vehicle really well. Yeah.
Okay. Is there a certain age, at least in Minnesota, when they are legally allowed to drive these, and is there some kind of training that they would go through?
I don't know that legal limits are always enforced.
Okay.
Sometimes these vehicles are used in areas where law enforcement really isn't even aware.
Yep. Private property and things like that.
Exactly right. Ideally, I think you think about when can you drive a vehicle. I think rule of thumb would be when you can drive a car safely, you're probably capable of driving an ATV safely. That's not necessarily an age. We know that there are some very mature 14-year-olds with appropriate direction from their families with good instruction and modeling, they may do just fine with an ATV. There are some 18-year-olds that are not very safe. Even though they may have license to drive a vehicle, maybe they shouldn't be because they're that risk taker. They may not wear that helmet. They may not model for their passenger exactly what is a good thing to do when they're on the ATV.
Okay. In regards to injuries that happen on the ATVs, are there certain risk factors that are going to be associated with more serious injuries?
Certainly, yeah. If they're not wearing helmets, as we've kind of already mentioned, that would be a big one. Helmets make a big difference in terms of preventing the serious head injuries. I think, again, the operator, the younger you are, the more likely you are to flip that vehicle. And once you have a rollover of an ATV, children can get pinned into that situation, and they're going to have more severe injuries as well.
Yeah, absolutely. And we've taken care of many of those children.
We have,
you more than me, but absolutely. So wearing helmets, education, is there anything else that you'd recommend in regards to the ATV safety?
Well, some states have found legislation to make a difference. There have been legislative efforts to be more proactive, more prescriptive in terms of putting a definite age limit on who can operate that vehicle. There have been successes with that. Also, sometimes pairing up the size of the ATV with the size of the child makes a big difference. So if you've got a large vehicle and a small child, well, that's just not going to go well. It might look great going down the driveway for 12 feet, but left alone without supervision, without a helmet, that little one is probably going to be challenged and more likely to be injured. So trying to match up size of vehicle with the child has certainly been what other states have done in terms of making differences in injury rates.
And I would add in there making sure your helmet is the appropriate helmet for ATV use and also correctly fitting, right? Because a lot of times if they're just loose, they're not going to do anything.
Exactly right.
Okay.
Yeah. And a helmet on the back of the vehicle or on the handlebars isn't helping anybody.
Absolutely, that invisible passenger, right? Okay, so you also mentioned motocross, and we see a lot of motocross around our area, and I'm sure other parts in the country as well. Can you talk a little bit about the risks of injuries associated with motocross?
Well, it's a big activity in our area. There are competitive motocross races in our area. We have tracks. There are kids from, I've seen as young as 7 in our emergency department to teenage years, and certainly there are adults as well. But they are out there in droves for these competitive races. And more we're finding that these children, again, may not have an understanding of their limits. I've seen the same 7-year-old boy in our emergency department 3 times for fractures. There's something should change there. Right. There's, you can look at the different options there, but I think an understanding of what those vehicles can do and the capability of your child is really important.
Absolutely. So Mayo Clinic, a lot of the research surrounding understanding the types of injuries with motocross has come out of Mayo Clinic. Can you talk a little bit about that research?
Sure. Actually, several of our staff have been at the sites. They've been at the racetrack to get firsthand information about what goes on there. One of the things that we have found is that many of these children are out there racing even after suffering concussions. We regulate concussions quite a bit when it comes to contact sports like football and hockey and lacrosse. We're all over that in terms of understanding concussion and assessing children for concussion and when they can return to play. Those same kind of rules of understanding aren't as firmly in place for motocross racers. They may be checked, they may seem okay, and they want to get right back on that bike and get back into the race. So I think that's one area where we certainly have found that kids are having concussions more than we realize in motocross.
Okay. Is there anything that they can be doing with their protective equipment to help prevent these concussions or serious injuries? Yeah.
Well, absolutely. I mean, again, most of them are wearing good protective gear. It's a matter of their judgment if they're impaired because of the concussion. But they are usually wearing their gear, a well-fitting helmet, those kinds of things as well. But I think one of the other issues is their incentive to get back on that bike and to get back into that race. We need to make sure that we're not incentivizing participation over safety.
Absolutely. Just the same thing that we see with football and other sports is really, taking that decision away from that child to get back in and putting it in the parents' or the medical supervision's hands.
Right. So. Exactly right.
Absolutely. Well, it is wintertime here in Minnesota. It's snowing here today.
Yeah.
Other parts of the country aren't seeing this, but I want to talk a little bit about some holiday safety and some winter safety.
Sure.
To start off with, we actually have a question from our viewer talking about sledding.
Sure.
So let's start with sledding, since today we may be enjoying that in Minnesota a little bit. This parent asked, at what age would their child be able to go sledding with kind of little supervision or no parental supervision? Is there an appropriate age?
Yeah, I think that's a great question. I think that depends on the child more than the age.
Absolutely.
Not to be vague, but as we talked about earlier, there are risk takers at age 12 and there are very cautious 12-year-olds. So I think you need to understand your child more than anything else, what they're capable of. Do they have that judgment to know where maybe they shouldn't be sledding and things like that? School age for sure, they should have that capability if they're not being supervised. And I would say even more towards 10, 11, 12, into that age group, that probably they're going to be independent. And a lot of that has to do with awareness of when does the day end and are they safe around others and things like that too.
Absolutely. Good answer. So parents are going to be getting out their snow blowers probably to get rid of the snow pretty soon. That poses also additional risk for kids. Can you talk a little bit about that?
Usually more the adult than the kid. Yeah,
it's true.
Yeah,
the fingers and hands.
Yeah, exactly.
Yes.
They try to clean out that chute and then they get a hand or an arm or even more stuck in there, and that's when they suffer the injury. But again, just similar to a lawnmower. Think about that. You're blowing snow. You don't really know what's underneath there. You may be blowing gravel or you may be blowing wood chips or something like that. If your kids are playing in the yard, then potentially they're at risk for that projectile coming to hurt them. So probably in general, just like we don't like to see lawnmowers out there when kids are in the yard, if you're using your snowblower, maybe the kids should just be in another part of the yard enjoying the snow outside.
Absolutely, and doing some other things like sledding, as we just alluded to. So there is also going to be a lot of downhill skiing and snowboarding happening over the next couple months all across the U.S. Are helmets necessary?
I think for snowboarders, you have to really think why you wouldn't wear a helmet. Again, they're going off the jumps. They're doing the maneuvers. They may be doing inversion moves and things like that. I think they're more at risk for the head injury. The skiers, again, it depends on your child, but they may benefit from a helmet if they're more of a risk taker, if they're more of the got to get down there as fast as possible. The cross-country skier, by no means do I think helmets are probably necessary there. At least I hope not. Maybe we're using the wrong skis on the wrong hill at that point. But in general, I would say the snowboarders in particular, because of the jumps and the moves that they're doing.
Okay. In Minnesota, ice fishing and ice skating are also going to be common and popular hobbies and stuff. Any safety tips or ways for parents to ensure that the ice is safe? Yeah,
I think two things. I think don't assume that the ice is safe until we've had some good, deep, hard freeze weather. You need to be aware of the lake conditions. If you can ask someone in the area, hey, how deep is this ice? Is it safe? If you see cars parked on that and they're okay, then probably it's safe for you too. But we often hear about someone going under either early in the season or late in the season, where we're not really sure about the depth of the ice and its safety. In addition to that, it's going to be exposure, right? So you want your kids not out there when it's too cold. They want to be wrapped up appropriately so we can risk the injury, the injuries due to frostbite and that kind of thing.
What are some of the early signs of frostbite?
Generally pain. Kids are going to say, my hands hurt. They might say it's too cold. And that's kind of probably your first hint. Later on, they might not, as frostbite gets deeper, if you will, or more involved, they may lose some of that sensation and they may not complain as much. So I guess complaining about the pain or it hurting is your first sign.
And that's when you should go inside and rewarm. Okay.
Absolutely.
Any tips on how to rewarm the skin at that point?
Slow and easy. You don't want to suddenly just put their hands in hot water because that rewarming can lead to some more discomfort and pain. But generally, more of a room temperature, maybe a little bit warmer than that temperature, is where you want to start if your kids are really having throbbing red fingers, hands, or feet. That you want to just gently put them in that tub of water where it's warmer than skin temperature.
Absolutely. One of the feet is a good sign, like right around that sock line where the snow can get in. I feel like as a kid, that's where I always had it happening. Well, let's talk about some of the dangers that can happen right there in your own home. So it's holiday season. There's going to be a lot of kids sometimes getting together with families and stuff, and there's new risks that sometimes you don't actually think about. What tips do you have regarding the holiday season with decorations and trees and fire and all those things?
Well, each year is not much different for we adults. We understand the fire risk, we understand candles, we understand things. But our children, as they grow, they change developmentally. So that infant from last year who was fine in front of the candle, this year is now a toddler and may not be so safe. Maybe fine around the Christmas tree and all the ornaments last year, but not this year. So I think we have to worry, what can they get in reach of? Yeah,
Right.
Again, just generally keep out of reach kind of things is what we're looking for.
Yep, and thinking about those cords too that are going to be around the Christmas trees and stuff, especially if you have a new infant or a new crawling child, right?
Exactly.
What about there's so many toys that are going to be unwrapped very quickly, and those toys sometimes comes with remotes and batteries and multiple little pieces and stuff. So we worry about button batteries. Can you tell me a little bit about what they are and what we're concerned about?
You know, it's interesting. I had a little girl who ingested a button battery in our emergency department not long ago, and the parents said to me they weren't even aware they had button batteries in their home.
Right. There's so many things that I don't realize that come with them already.
Yeah. And I think part of that's awareness. I think we have to assume, just like medications, which we don't really have time to talk about today, but just like medications, we all have button batteries in our home. It's just a matter of what type and where they are located. It might be how often we use them. But you're exactly right. They're in remote controls for games, toys, even Christmas ornaments. My wife and I were putting up ornaments from last year and realized a few of them need button batteries to create the sound. And you don't even think about that from year to year.
Right. So those button batteries can fall out. And they look interesting. So a kid ingests them. And why are we so concerned about the risk of a button battery?
Absolutely. Well, even if they're not fully charged anymore, even if they've lost their charge, they can cause some significant damage, especially in the moist mucosal surfaces. So the lining of the nose, the back of the throat, the esophagus itself. They can very quickly cause thermal damage to those areas, especially if they're there for a longer period of time.
Okay. And so if they think their child has ingested one of those or put it in their nose or their ears, what should they do?
Well, if we think it's a button battery, they need to be seeking care right away. Yeah. If it's stuck in their esophagus or in the back of their throat, it needs to be removed promptly. We're talking, 30 minutes to an hour kind of thing where we can see some damage already taking place.
Absolutely. It's not like, trying to watch it for a little bit with a small, small little object or something that they may have ingested. You need to get to the ER. Okay, sounds good. We have some great questions from viewers about other things that can happen in the house that aren't necessarily related to holidays.
Sure.
But carbon monoxide poisoning is something we tend to see a little bit more in the winter.
Absolutely.
Is that truly higher in the winter, the risk for it, and why is that?
Absolutely. Well, number one, we're all inside. We're not outside the way we are in the summer months. Again, depending on the weather, some kids are, again, more likely to stay inside than go outside. So even when it's very cold, if we keep our kids inside, they're exposed for a longer period of time. In addition, kids are at higher risk for carbon monoxide poisoning because they're in a closed environment for a longer period of time. So they're in a daycare situation all day long. They're in our home all day long. We come and go to work. We come and go to, do errands in the grocery store, go shopping. But that child is in that environment all the time. So if there's elevated carbon monoxide levels, they're probably the canary in the mine, if you will. They're the ones that really are going to be exposed and are more likely to have symptoms sooner than you or I will.
Okay, what are some of the symptoms to watch for?
Yeah, and you and I, we'd probably talk about being nauseated, having headache, feeling tired, feeling fatigued. Well, how does an infant or a toddler tell you that? Well, it can be kind of nondescript. So you have to think about it. Keeping those carbon monoxide detectors up and running and paying attention to when they go off is important, because that fussy toddler, that fussy infant, that poorly feeding infant, that baby who naps a whole lot longer than usual, that could be the only sign you have of carbon monoxide poisoning in a child that age.
So most sources of carbon monoxide poisoning are probably going to come from a furnace inside. So getting your furnace service is going to be important. Carbon monoxide detectors, they can probably be, I'm guessing most of the ones we have in our house are going to plug into an outlet, but I'm assuming there's battery ones as well.
Should be battery backup in those as well. In our home, they're actually hardwired into the wiring, system. Which is into the system. So with battery backup. So I wouldn't disarm any of those. If that alarm or that battery chirps and it's becoming annoying, well, we have to pay attention to that. We got to replace those batteries.
Yep.
Yeah.
Yep. So and check your batteries if you may have one that doesn't chirp, because it is important. And like you said, the symptoms are pretty nondescript.
Right.
So we have one other question from a family about having a little infants and smaller kids around the house. Their concern is about plants. Going to people's houses that may have plants and poinsettias and things like that.
Sure.
Are these concerning to have around younger children, or are there certain ones that you would be most concerned about?
Well, there are a number of houseplants that can be injurious to kids. Generally, it's not systemic toxicity that they're going to end up with. They're not going to end up very, very sick, but it's probably more local irritation. It may lead to some burns in the mouth. It may lead to, if they swallow them, burns in the lining of the esophagus kind of thing. But generally, they're fairly well tolerated. And I think more and more people are aware of the plants that can cause problems. Poinsettias are one of those. But there are other plants, too, that can cause some caustic injury or burn to the mouth, the throat kind of thing.
Okay. So if they had those symptoms, could they watch them at home, or should they be bringing them in?
Probably worthwhile to have them brought in so that we may not appreciate the full extent of the injury just by looking at the child. They might have spared injury to their mouth, their tongue, and have further injuries that aren't quite visible. So if they're refusing to feed, refusing to eat, refusing to drink, certainly those children should be brought for evaluation.
And that advice goes for any type of ingestion within a child. They really should be evaluated by a medical person.
Right. And always the option is to call poison control.
Absolutely.
People might think about that for medications, but it's also true for plants and for things like button batteries or something like that. They can give great advice as to when to seek care. It's a great resource. Many things that kids ingest, they'll ingest anything, but many things are not toxic, and parents want to know, when do I need to bring my child in? And it's not hard to do. It's 1-800-222-1222. You can call that number wherever you are in the country, and they'll patch you into the regional poison control center to give you information and direction.
The poison control helpline or hotline is so helpful. We use it all the time as medical providers, but I've used it as a parent at home, and they even called to follow up with me the next day and the day after, and it's a free service. So I love the poison helpline. This is all the time we have for today. This was great. I think we're going to have to come back and talk about other safety concerns because there's so many. Yeah,
there are quite a bit. And again, it varies quite a bit by season. It varies quite a bit by the child's developmental age. But you're right. I'd be happy to come back and talk more about those things along the way.
Fabulous. Thanks, everyone, for watching and join us who sent in questions today. Join us for the next Ask the Mayo Mom in the new year on January 11th at 11 a.m. Central Time. Dr. Sharish Kodagal and Dr. Robin Lloyd, both pediatric sleep medicine experts, will join me to discuss sleep problems in kids. We will be covering everything from sleep concerns in young children to teens. So join the discussion and please send in your questions in advance. Thanks, everyone, and have a wonderful day.